สวัสดีค่ะ From the Federation of the Asian Veterinary Association, FAVA Secretary Office, Bangkok, Thailand, and our co-host, Thai Veterinary Medical Association under Royal Patronage, TVMA. Good afternoon and welcome our distinguished guests, invited speakers, and attendees in the record atmosphere from the celebration of World Antimicrobial Awareness Week, WAAW 2021 to the roadmap to celebrate WAAW 2022 in the coming November, which is starting today. I am Professor Achariya Sailasu, Director of the FAVA Office, Bangkok. It is my great pleasure to be the moderator of the FAVA-TVMA-Regional Seminar on the roadmap to celebrate WAAW 2022 in the coming November 2022 in the theme of FAVA Strategy to Tackle Antimicrobial Resistance 2021 to 2025. On the 7th September 2022 at 2 to 4:30 p.m. in the Health Nutrition Asia WITAM Asia 2022 at Impact Muang Thong Thani, Bangkok, Thailand. This is a hybrid seminar which is conducted physically here in this room and live on the FAVA Facebook and other Facebook in Thailand and international, especially with the CU Radio Plus, Faculty of Veterinary Science, Chulalongkorn University, and of course, the Thai Veterinary Medical Association Facebook. Please also share together with us. It is realized that the antimicrobial resistance, or AMR, is a regional concern and become an issue of the livestock production globally. FAVA totally agree to promote the collaboration and advocate knowledge among national, regional, and international agencies, and discover the way for addressing future challenge on AMR in the region, aligning to our strategy. Regards to the WAAW is the WAAW, World Antimicrobial Awareness Week, which aims to increase awareness of global antimicrobial resistance and to encourage the best practices among the general public, health workers, and policymakers to avoid the future emergence and spread of drug resistance infection. It was started by World Health Organization. Now, the Food and Agriculture Organization of the United Nations, FAO, the World Organization for Animal Health, and the World Health Organization joint effort are coordinated on the One Health approach and constitute the tripartite collaboration on AMR since 2018, which all the parties and stakeholders collaborate and celebrate together. In 2020, FAVA has started the AMR campaign on collaborating with the FAO Regional Office for Asia and the Pacific, FAO RAP, on WAAW 2020. And next, for 2021, FAVA and FAO again expand the focus area to cover more of important components and create impactful drive for the AMR works in the region under the theme of empowering veterinarians in Asia towards fulfilling their roles on the Global Action Plan on Antimicrobial Resistance, or GAP-AMR. The overarching work attempts to align FAVA with the Global FAO Action Plan on AMR 2021 to 2025 and its 5 strategy objectives. 1. Increase stakeholder awareness and engagement. 2. Strengthening surveillance and research. 3. Enable good practices. 4. Promoting responsible use of antimicrobials. And 5. Strengthening governance and allocating resources sustainably. All the strategies are the highlight of the seminar today. In the theme of FAVA strategy to tackle antimicrobial resistance 2021 to 2025, on declaring our strategy to all the stakeholders in Asia to create a great impact and recognition on One Health and WAAW 2022, which will celebrate in the 21st FAVA Congress during November this year in Fukuoka, Japan, which will indeed serve a platform to highlight the success of FAVA-FAO-Regional collaboration on AMR with the official announcement of the FAVA-AMR strategy 2021 to 2025 for the regional One Health declaration. Yes, it is my great honor to conduct the opening ceremony of the very important and highlight of the seminar today. First of all, allow me to welcome Dr. Kwasa Nisam Madin bin Hassan Nisama, President of FAVA, to deliver the opening speech. Please welcome Dr. Kwasa.
Thank you, Professor Dr. Acharya, for the opening remarks, and very good afternoon to Dr. Settakya. Sorry if I don't pronounce it correctly. TVMA President, Dr. Ronald Labila, a good friend from the World Organization of Animal Health. We have with us Dr. Mary Joy Kurazilo from FAVA-TVMA, just including from Manila. Also my executive board, Dr. Bambang, Secretary General of the Corazon, is here to share with you all some of the work we are doing. And esteemed guests, and also greetings to all veterinarians, farmers and industry players who are joining us in this seminar, as well as probably online, either physically or virtually. Thank you for allocating your time for this very important topic which we have been discussing globally, regionally, also nationally. So I warmly welcome everyone to this FAVA-TVMA regional seminar on the roadmap to celebrate WAAW, this World Antimicrobial Awareness Week 2022, which we already started doing our programs and activities finally when the WAAW happens in November, right? So we have worked hard on this FAVA-AMR or FAVA strategy to tackle antimicrobial resistance. So I'll just briefly explain what we have been doing. But before that, I thank the organizing committee for inviting us to be present and to interact and share our work we have been doing. And it's so much related to the exhibition itself, which is the health and nutrition, feed, animal feed, and so on. So it's all related on using antimicrobials and how best or prudently we can manage antimicrobial use in the livestock industry, the aquatic industry, and so on. FAVA, as you know, FAVA is the Federation of Asian Veterinary Association. It is a 27-member country association. We have an outreach of more than 100,000 veterinarians, and this is where we think we can play a complementary role in terms of trying to reach out to veterinarians to help complement the important work in terms of antimicrobial resistance. So we had this opportunity of working closely with FAO-RAP, Mary Joy Kurazilo especially, and since 2020 we have been working together, and we have carried on in 2021, and we hope to further continue our collaboration with the FAO-RAP 2022. They have done quite a significant amount of work on this area of FAVA strategy to tackle antimicrobial resistance. The more details of the strategy will be discussed by my colleagues, myself, and all my colleagues who are here today, Dr. Bamba, Dr. Razon, and of course Dr. Mary Joy. But basically we have, as you know, Asia is a very intensive livestock production continent, and there's India, China, and a lot of livestock production happens. And in tandem, there seems to be a lot of use of antimicrobials in the industry. And so when there's this protection is done, and if we do not mitigate this problem, the impact of the problem will be faced by Asia the most. And so we need to take the necessary action so that the misuse and abuse of antimicrobials can be reduced, and try and promote responsible and prudent use of antimicrobials in livestock industry. So with this sharing of knowledge and experience and what we are doing, we hope we can empower the veterinarians, veterinarians, veterinary associations, and even the veterinary students to come together and try and mitigate this problem before it becomes a global pandemic, which is expected. Nothing is done by 2050. And we need all support. We can write beautiful plans, but we need the stakeholders to come together to help and ensure that plans and activities or action plans which have been planned out can be carried out effectively to reduce these effects and the impact of this antimicrobial resistance in the industry. So I thank you all being present here, and thank the guests who have given their valuable time for this effort. I really appreciate your presence, and all of you who are attending it physically, also virtually. And I hope this seminar will give the necessary impact for veterinarians to use antimicrobials. We are really targeting, because like I mentioned earlier, there are over 1,000 veterinarians in the Asian continent. So can we come together and help mitigate this problem of AMR? That's the message we are trying to push ahead. So we want to play a part to solve this problem or reduce the impact of this problem finally to the human. So lastly, I take this opportunity to thank FAVA, TVMA, VIB, Asia Pacific for this collaboration, for bringing this seminar here this afternoon. And we hope with this seminar there will be a little bit of improved efforts from us, the veterinarians, the veterinary associations, and veterinary students to have improved. Thank you all to the participants, and I wish you all a successful seminar, and together we try and make a difference to the world. Thank you very much. Thank you.
Thank you very much, our President, Dr. Kwasat Nisamuddin bin Hassan Nizam. Yes, next, I would like to invite Dr. Sethikiat Krajang, the President of the Thai Veterinary Medical Association under the Royal Patronage, TVMA, to deliver the welcome speech. Please welcome Dr. Sethikiat.
สวัสดีครับ FAVA President Dr. Kwasa Nisamuddin Hassan Nizam, the World Organization for Animal Health Sub-Regional Representative for Southeast Asia, Dr. FAVA Secretary General Dr. Prampan Wancho, Director of FAVA Officer Bangkok, Professor Dr. Acharya Sailasu, honorable speakers, distinguished participants, ladies and gentlemen. On behalf of the Thai Veterinary Medical Association under Royal Patronage, It is my great honor and privilege to welcome all distinguished participants to the FAVA strategy to tackle antimicrobial resistance 2021 to 2025. The FAVA strategy to tackle antimicrobial resistance 2021 to 2025 seminar will focus on strategy, improve quality and safety on antimicrobial and their appropriate use in humans and animals, improving infection prevention and control, strengthening supply system of medicines. I strongly believe that this seminar does not only catch the attention of veterinarians who have a significant role to reduce the burden of antimicrobial resistance in livestock sector, but also of several key stakeholders, since antimicrobial resistance is now considered a major threat to modern medicine and global economy. Ladies and gentlemen, the FAVA strategy to tackle antimicrobial resistance will offer an excellent platform for our veterinarians and participants to share and update the concerned antimicrobial resistance situations. I hope that we will have an excellent time learning from each other and fruitful conversation. Finally, I genuinely wish this seminar will further bring the strategies and as the utmost goal, improving awareness and strengthening knowledge and antimicrobial resistance. Once again, welcome all the distinguished participants, and I wish all of you to have a productive and successful meeting with a wonderful experience in Thailand. Thank you.
ขอบคุณมากค่ะนายสัตวแพทย์เศรษฐเกียรติกระจ่างวงศ์ท่านนายกสัตวแพทยสมาคมแห่งประเทศไทยนะคะ Thank you very much Dr. เศรษฐเกียรติกระจ่างวงศ์ President of the Thai Veterinary Medical Association under the Royal Patronage TVMA. Yes, I think now we are going to the last our invited guest today. I would like to invite Dr. Ronaldo Avila, the World Organization for Animal Health Sub-Regional Representative, Southeast Asia, to deliver the opening speech. Please welcome Dr. Avila.
Thank you, Dr. Professor Acharya, the Director for FAVA here in Bangkok. The President of FAVA, Dr. Kwasanir Sabuddin, a very long-time friend, a classmate. We met during our master's class in Berlin, how many years ago? To the President of the TVMA, Dr. Saratin, and to the other officers of FAVA, Dr. Bambang, Dr. Cora, and to our keynote speaker or for this webinar, Dr. Joy, one of the experts who are here in our region. I would say from that the FAVA strategy, the role of FAVA in spreading the good news about the benefits of controlling AMR is very, very critical, and it has been very effective during the past few years. I would say the rates that you have really, the number of professionals that you have reached, you have expanded, the number of not only professionals, practitioners, but also the industry that you have covered all over Asia has been really very tremendous, and I would like to congratulate you for that. And I would say the campaign for antimicrobial resistance is not only about regulating to reduce the usage of antimicrobials in livestock production, but hand in hand, it is really revolutionizing the livestock industry in our region. Why I am saying this? Because when you institute the reduction program to reduce antimicrobial usage in the farm, definitely you have to institute good husbandry practices, biosecurity, and other measures. There could be some farms, old farms, that may not be able to immediately adopt such measures because they could not, it may need some engineering intervention, the housing, and so even if they intend to reduce the use of antimicrobials, they might still suffer some losses if they could not really institute good biosecurity within the farm. So it's really a big challenge for some of those farms. But I would say the FAVA could work closely with the industry to showcase some best, I would say, practices to show the benefits of instituting program to reduce the use of antimicrobials. And I am very, I would say, positive, and I believe that many farms who have instituted programs to reduce the use of antimicrobials are also gaining economic benefits, and it would be good to really document scientifically most of these farms and to showcase in our area. It has been proven in many developed countries the benefits or the economic benefits that they would gain, because the impression coming from other sectors, particularly from the health sectors, blaming us in the livestock sectors, that they are not really very serious in reducing the use of antimicrobials because it will not benefit them. If they will reduce, they will have more mortalities. So that's the impression, and we should be able to counter that impression from the other sectors, from the medical sectors, and from the other sectors in our society. So we are responsible producers in the industry, and we could show them that we are serious in our campaign to reduce AMR, and we are contributing in reducing AMR usage in our sector. So in the coming years, I would say that's a big challenge for us. The World Organization for Animal Health is we are now on the 6th year, actually going to the 7th year, in monitoring globally the use of antimicrobials. And we have in our website the reports in many regions, and later on it will be available, so monitoring per country, the reduction or the usage, is there a reduction, or is it maintenance, or is increasing utilization of antimicrobial usage in many countries. So we are encouraging policymakers, industry to talk to each other, to target how you could work together to target to reduce antimicrobial utilization. I know here in Thailand, they have targeted, I think, 20% over a 5-year period to reduce the usage of antimicrobial, the use of antimicrobials in the farms. And I look forward in other countries that would do the same. So because it has been proven that if we could reduce the use of antimicrobials in the farms, in the industry, then it will not only benefit less cost of production, but also it will benefit generally the health of the population. So I look forward to the success of this seminar. Again, this is one of those continuing seminars to really make us aware on the benefits of reducing the use of antimicrobials. Thank you.
Thank you very much, Dr. Akira, for the warm opening speech. Now, the seminar has already officially started, but allow me to have only 1 or 2 minutes for a group photo, which should be a very historical photo for the AMR declaration today. Yes, we are invite our honorable guest and invited speaker at this stage for the group photo in the beginning, and then after that we will start continuously for the scientific content. Thank you. Yes, Dr. Bangban, Dr. Joy, Dr. Corazon, Dr. Miss Midori, join us. Yes, thank you very much, our honorable guest and our invited speaker. Yes, this is the time for everyone that is waiting for the regional seminar on FAVA strategy to tackle the antimicrobial resistance 2021 to 2025. Firstly, it is our great opportunity and honor that we have a very special keynote speaker today. Today, our keynote speaker, Dr. Mary Joy Gononcillo. She holds a Doctor of Veterinary Medicine degree from the University of Philippines, Master of Tropical Veterinary Science from James Cook University, Australia, and PhD from Michigan State University, where she specialized in the antimicrobial resistance, or AMR, in livestock animals. She is now the AMR Regional Project Coordinator at the Emergency Center for Transboundary Animal Disease Operation, ECTAD, of the Food and Agriculture Organization, FAO, Regional Office for Asia and the Pacific. Part of her work, it has been developing tools, strategies, and innovative solutions to mitigate antimicrobial resistance in the food and agriculture sector in Asia. Prior to join the FAO, she served as the Science and One Health Coordinator of the World Organization for Animal Health and sub-regional representation of Southeast Asia. And of course, she is also the assistant professor at the College of Veterinary Medicine, University of the Philippines. Yes, now it's time for meet her already. Today, Dr. Mary Joy Gononcillo will deliver the topic of the empowering veterinarians on AMR mitigation in the Asia-Pacific region. Please welcome Dr. Mary Joy Gononcillo.
Thank you, Dr. Echeria. It's really a pleasure to be here. After more than 2 years, it's good to see people outside of screens. It's my first time to meet some of the people. It's also good to meet old friends and good colleagues. So for today, I'll be talking about empowering veterinarians in the Asia-Pacific region and AMR mitigation. It's a particular topic that's close to my heart because I think in Asia we really need this empowerment of veterinarians. So let me start with my outline. First, I'll be talking about veterinary contributions to global health, the economy, and to the overall society. And then I'll be talking about veterinarians from the One Health context on AMR mitigation. Then I'll be discussing a little about the actions or what's happening around the region on what's taking place in empowering veterinarians to improve our capacities and engage everyone and interconnect everyone into this collective action to address this global health threat. And then, of course, a special mention of collaboration with FAVA and our ways forward. So first and foremost, let's talk about veterinary contributions to global health, economy, and society. We all know that some of the roles and responsibilities of veterinarians is always like to protect animal health, conserve animal resources, relieve animal suffering, and promote public health, as well as advance knowledge. There are many others, but these are the key actions or key roles and responsibilities when we swear our oath to become veterinarians. In so doing, in the process, we fulfill these professional roles. We translate this into veterinary contributions, very useful veterinary contributions. We work on mitigating disease, we do risk analysis, we reduce the risks not only within animal health population but also with public health. We contribute to the global economy, we reduce poverty in the process. So our roles and responsibilities attached to this are contributions overall. In summary, this leads to a higher purpose, or higher calling, or higher purposes of veterinarians to contribute to a world with healthier animals, with healthier people, with better economies, with better communities, and also with a better society. So collectively, this is the work that we do by committing to our roles and responsibilities. Now, in AMR mitigation, which is, as we know, is a global public health issue at the moment, and it's been existing long before it's recognized. But now, with the rampant use, these are building up more and more. And if we're not going to do anything, the world will be suffering. So, what can we do as veterinarians? How can we contribute to this global public health issue? We know that AMR in bacterial organisms does not recognize biological, physical, or sectoral boundaries. It does not mean that if it's from humans, it can go to animals and vice versa. We also see that its potential transmission pathways includes broad areas of disciplines that are often traditionally segregated. So human health are usually not really designed to be crossing over the animal health work. The collective and coordinated actions across these multiple disciplines can leverage on the strengthened sectoral accountability towards AMR mitigation. We cannot force people to just immediately work together, and the answer is One Health. We need to also be strong enough so that when we come to the table of One Health discussion, the veterinary contributions will shine the way it should. So this is just not about coming together, but also being strong individually, being strong collectively as a profession, so that we bring a synergistic outcomes from our One Health discussions. So this ensures that the efforts of nations to address this global issue will benefit from the respective expertise of each sector, and that actions are also well sustained by their respective mandates. That's the beauty of One Health work. We come together as strong individual sector, but the operative word is we come together. And this is what makes One Health effective, because we come strong as individual sectors and we discuss and synergize. Now, from the perspective of AMU and AMR, from the One Health perspective, there is a substantial body of evidence to support the view that the emergence of AMR in bacteria in livestock population is connected to the emergence of AMR in bacterial population that colonize and infect humans. We have seen this in several situations where AMR arising from the animal health sector, we see them in humans. But this is not the only situation. It is also it's also clearly evident that most of the emergence of AMR in bacteria in humans appears to originate from antimicrobial use in humans as well, while majority of AMR in animal sector are arising from the use of antimicrobials in animal sector. So although there are stories of crossovers, there are also strong evidence that antimicrobial use is the triggering factor. So we see this in a lot of phylogenetic studies. I studied the enterococci, vancomycin-resistant and enterococci in swine populations. And what you see is that although the stories connect, you can see TREs, when you look at them molecularly, they are not connected. So PREs arising in pigs are PREs arising from the use of drugs in antimicrobials in pigs. The vancomycin-resistant enterococci arising in hospitals are arising because of the use in hospitals. They are in no way crossing over. However, of course, there are stories that MRSA, for example, methicillin-resistant Staphylococcus aureus, contacts of farmers to pigs, for example, they cross over, they spill over. So that's also a story. But what is clear so far, and what is clear is that what is generally accepted in both humans and animals is that there is a positive association between the volume of antimicrobial consumption and prevalence of resistance in the exposed bacterial population. So this happens both ways. But what's happening also is that if we can address what's arising in the animal population, we will also be able to effectively mitigate the antimicrobial resistance arising in human population. So it's a win-win situation. Now, this is where the One Health approach is called for. This approach is the collaborative effort of multiple health science professions together with their related disciplines and institutions to collaborate so that they have synergistic effect on the work that they do. And this is one. Anyway, so that's One Health for us. I hope it's clear enough that while there are unique situations where we see AMR in animals and we see AMR in humans, we do not jump to conclusion that almost always they are linked together. There are also situations, by the way, that AMR in humans spill over to animal population. And this also poses a problem in livestock and in fast turnover, short lifespan of animals. Because one farmer, for example, one swine farmer that's affected with MRSA, if he contaminates his herd or poultry, for example, then it effectively transports all the antimicrobial, it opens the opportunities for antimicrobial resistance genes and antimicrobial resistant bug to spread because, trade, we transport animals, they have short lifespan and they can maintain the infections. So this is an interesting feature. Usually what's emphasized is animals to humans, but it also happens that humans to animals also occur. What's interesting is that the way that we are structured in the animal health sector, it will further export or expand the coverage and expedite the speed by which AMR is spread. Now, as a response to this emerging issue, global health issue, WHO together with WAAW and FAO built this global action plan, which underscores the need for an effective One Health approach among numerous international sectors and actors, including human and veterinary medicine, agriculture, finance, environment, and well-informed consumers. Now, this has 5, I'll just be quick because apparently I only have 10 minutes left. So pillars of work: awareness, surveillance, good practices, infection prevention and control, prudent use or responsible use, and governance. Now, this is for everyone, so public health and animal health. And for food and agriculture, we have similar, same patterns, so you can see that they are well aligned, but it's focusing on food and agriculture. And this being under food and agriculture, the veterinarians, we can see that they are also saying, what can we do? How can we increase awareness? How can we increase surveillance? How can we contribute to enabling good practices? How can we promote responsible use? How can we strengthen allocating resources? So these are, what are our roles in food and agriculture, under food and agriculture? What can veterinarians do to contribute to this global movement? And I have to be quick because I still have a lot of slides. While this may be fair expectations, fair enough, they're expecting that from us. But then there's a bit of and we need to understand also that this is not a good driver for veterinarians because we have some issues. There are still challenges surrounding our situation. AMR is relatively new thing for us because, although surveillance has been happening here and there, it's relatively new. There are limited capacities, tools, and resources, and high-risk farming practices are dictated by economic drivers. And I think this is a key important for us if we want to be effective. We need to understand what drives antimicrobial use in our sector, in the animal health sector, what drives veterinarians to use it, so that we can effectively institute change. There are still many gaps of knowledge for the animal health sector. For example, lack of veterinary clinical frameworks. So it's still a lot of challenge. There's still a lot of challenges before us from the animal health sector perspective, from the veterinary perspective. But what is happening now, as you can see, things are building momentum. The momentum is building up. It is very good collaboration with FAVA, driving the veterinary force. FAO is doing a lot of things. OIE is doing a lot. OI is doing a lot of things. A lot of initiatives are forthcoming. So we need to reinforce veterinary professionals responding to this global call for action. We need to enable them. We need to empower veterinarians to be able to contribute effectively to this global force. Now, I'll be really quick. I think the slides will be available anyhow to everyone. But what I did here is just identify what are the veterinary roles in each of the pillars. So we have the vet authority, academics involved in awareness and engagement. For surveillance, we have the vet authority, the laboratory, vets working in lab, working in surveillance, working in research. And particularly for good practices and responsible use, these are field vets, farm vets, and all other vets. So that's all encompassing. And for governance, of course, the veterinary authority. But just to mention some of the highlights of the work for each pillar. For awareness, there has been a strong move, as you will see later also. FAVA has been very instrumental in reaching across the region veterinarians through World Antimicrobial Awareness Week seminars or webinars that have been doing in spite of the lockdown. We've been doing this for the last 2 years and hopefully we can continue this year. So under this collaboration also, and we will hear more of the AMR strategy later, there will be targeted campaigns, trainings, and professionals, and promoting investments for AMR awareness activities across the region. There are also other resources for vets. So what I will be listing here, from here onwards, are resources that veterinarians can access if they would like to be involved. So some examples, sorry, it's almost not visible, but when you see we have the copy, you can click the link to some of the resources that you could use or to understand or maybe see what's happening in other countries in the region when it comes to AMR awareness. For surveillance, this is the area that I'm working, so maybe I'll spend a little extra time here because I think I'd like to help people understand also that for AMR surveillance, AMR is not just about public health emphasis. So we do a lot of AMR monitoring, surveillance, and bacteria from healthy food animals and their byproducts, also residues. So these are areas that that enter the market. Diseased animals, on the other hand, should not reach the market, but they're also using antimicrobials. But it requires a different panel of antimicrobials. It requires different objectives. What our objective here is to identify the most effective treatments available. So in this way, we have different methodologies. For example, if we're looking at the first part, healthy animals that enter the food chain, what we are looking for is what spills over the human population. So that our panel of antimicrobials are antimicrobials that are important for the public. For the diseased, the panel of antimicrobials should be antimicrobials that are important to animals because we want to develop treatment guidelines. So attached to this, for the people here, for vets here who are working on the lab, understandable that conditions will be different. Target isolates will be different. Primary isolation will be different. Sampling methods will be different. For fish, for example, I'm not a fish person, but I learned that they require different temperature, different medium. So these are some of the unique features of this. But what's more important also is to know that clinical breakpoints in humans are different from clinical breakpoints in animal species. So it's really an issue because there are very few veterinary clinical breakpoints. We're also working to develop this or working to contribute to building veterinary breakpoints, veterinary clinical breakpoints. So aside from this, it's also important to have monitoring use of antimicrobial use at the farm level. So right now, FAO is collaborating with OIE in developing a guideline for this. For all these aspects, we have regional guidelines to make it easy for veterinarians and other people working on surveillance to be able to do this. So we have respective guidelines for healthy animals. You can access this. The rest are almost available very soon. And then you can also see here, CLSI documents. There are now available free download for this one. So for infection prevention and control, this is more attached to the biosecurity for prevention and control of diseases. This is reducing the need for use. We try to, veterinarians can contribute to reduce the need for use. When there's no infection, because we have clean farms, we have good food for the animals, there's less need for antimicrobial use. So this area of work is reducing the need for use. And in this way, we have like some work in FAO for what you call as Agri-IDC or agriculture version of infection prevention and control, which is also attached to agriculture, water, sanitation, and hygiene, ensuring that the outcome is to reduce the need for use. We've also been collating regional evidence-based documentation of what success looks like. And so we are building a regional virtual library of good practices that could be useful for others. Again, just listing here some of the resources that you may find useful in case you would like to explore more on infection prevention and control and generally good practices that can reduce the need for antimicrobial use. Now, if we really need to use, we have to use it properly. So it's a different story when you reduce the need for use, that's preventive. But then when you really need, of course, these are medical agents that we need to be maintaining to be effective. But if we need to really use it, we need to use it properly. So these are some of the activities in the region that is happening. FAVA, for example, we have established antimicrobial stewardship subcommittee, which I think we'll be discussing further detail by Dr. Occidental later. Been collating existing therapy guidelines, virtual library of documents on antimicrobial stewardship, what has been shown to work, development of national treatment guidelines. Several countries are now starting to develop evidence-based treatment guidelines, which are needed by veterinarians. And currently, we're establishing a community of practice of people involved in developing treatment guidelines for poultry and swine. We're starting with Southeast Asia, so hopefully we can expand to South Asia. But this is an ongoing initiative at FAO-TVMA. So again, just a list of resources that you could tap or you can access, freely downloadable, in case you would like to learn more or see more examples of prudent use guidance. Now, lastly, strengthening governance and allocating resources. This is where the power of coordination, collaboration works. Because with all the science, I think it's still important that we are connected and we talk to each other and we create good music together. Otherwise, even the best cellists, the best pianists, the best violinists, if they don't coordinate, it will still be noisy.